I'm Jordan, a level 1 nursing student. Can I get your SBAR report?
Sure. We have Shanae O'Connor. She is a 34-year-old female in room 231. She is a patient of Dr. Engelbert's. She was admitted with a fever of unknown origin. She has a field code allergy to trimethoprim, sulfamethoxazole. She is up with activity as tolerated. She came into the ED with fever, chills, malaise, elevated blood glucose, decreased appetite, and minimal urine output. She has a history of diabetes for 26 years and stage renal failure secondary to diabetic neuropathy and hypertensive nephrosclerosis. She had a graft infection 3 months ago, which resolved with IV antibiotics, and she does have recurrent UTIs. She's alert and oriented ×3. She has the IV in her right forearm, the AB graft in her left forearm, denies any tenderness, drainage, or color change. She did have a recent weight gain of 10 pounds over 2 weeks. She reports stark concentrated urine of low frequency. She denies any pain, burning, or difficulty with urination. She reports numbness and tingling to the lower extremities and reports decreased sensation. She is tachycardic with regular rhythm, 1+ non-pitting edema, lower extremities with 1+ pedal pulses. She doesn't have any other complaints to the head, neck, back, or torso, and her bowel sounds are present ×4. Her last vital signs: temperature was 101.9, blood pressure 138/78, heart rate 95, O2 sats are at 96 on room air. Her last blood glucose level was 155 at 7:30. She will be on a renal diet with oral fluid restriction of 1,500 milliliters per day. Her urinalysis resulted in showing elevated white blood cell count. We will closely monitor her I's and O's and vital signs, notify the physician if she has a temp greater than 101 or a blood pressure greater than 180/100. We'll maintain her sats above 92%, check daily weights. Her blood glucose checks are before every meal and at bedtime. For now, we will be giving her an antibiotic to treat the infection. Her CBC, CMP, and urine culture are all in the lab pending results. Any questions?
Yes. Why specifically is this client receiving this medication, and what action does the medication have on the body?
The client is showing white blood cells in the urinalysis, so we'll be giving the imipenem as a broad spectrum bactericidal until the culture and sensitivity results are back. The imipenem binds to the bacterial cell wall, resulting in cell death in combination with the cilistatin that prevents renal inactivation of the imipenem.
When should you question administering this medication? Does the medication have a therapeutic serum level? Which vital signs must be monitored, and which physiological parameters should be monitored when the medication is being administered?
We'll question if she has any hypersensitivity and renal impairment with her end-stage renal disease. If she wasn't having dialysis scheduled within the next 48 hours, we would definitely question giving the imipenem. We'll monitor all vital signs, especially her temperature, her blood pressure and pain, and her heart rate. We'll monitor I's and O's, assess her urine concentration and color. We'll check for signs of anaphylaxis like rash or laryngeal edema, and we'll monitor her labs, her BUN, creatinine, hemoglobin, and hematocrit.
What interventions must be taught to the client to ensure the medication is administered safely in the hospital setting and at home?
We'll advise the patient to report any signs of superinfection, like black furry overgrowth on the tongue, or loose or foul-smelling stools, and of course any allergy. We'll have her contact the provider if fever and diarrhea would occur, and advise her not to treat any sort of diarrhea without consulting the physician first.
What are the side effects and potential adverse reactions?
Seizures, dizziness, hypertension, C. diff-associated diarrhea, nausea, vomiting, phlebitis at the IV site, fever, anaphylaxis, and superinfection.
How will you know the medication is effective?
When the signs and symptoms of an infection have resolved.
Okay.
patient's MAR, and I am going to.
Well, we would first and foremost
plugged in.
get the right trachea. We'd also want
The Oh, laptop is plugged in. I'm going to
right patient, right dose.
pull the medication that
Uh-huh.
we need, which is going to be the imipenem
Uh-huh.
and the normal saline.
We'd also explain the part why they're
We'll check with the pharmacy to make sure that those two are compatible.
Mm-hmm.
Okay. And what intervention did you teach about taking the medication at home?
Diarrhea or blood in the stool. Okay, I'll look at what you're doing.
Yeah, sure. Okay. Well, we might as well just knock and get one.
I'm just having trouble seeing. These would be dizziness, seizure,
In the back.
hypertension, diarrhea,
Thank you. Hi, I'm Andrea. I'm your nurse today.
Hi, Andrea. My name's Shindane O'Connor.
Yeah, what's your date of birth?
34.
Cool. Do you have any allergies?
I'm allergic to trimethoprim, sulfamethoxazole.
We are here to give you your administer.
Okay, so I'm here to give you your imipenem, which is an antibiotic. Are you aware of why you're receiving the antibiotic?
Vaguely, I understand I have an infection.
Yep, your white blood cells are increased and showing in your urine, and you have an elevated temperature.
Okay.
Do you know of any side effects that you should be looking for?
Signs of an allergic reaction.
Yep.
Anything else?
Any breathing problems, changes in your heart rate, confusion, dizziness?
Okay. Thank you.
Just put on your collate.
All right, I've got it right here.
Perfect. I did print out something for you that goes into a little bit more detail of your antibiotic. If you have any questions, let me know.
All right, thank you.
Okay. So, double checking my medications with the MAR. I have the imipenem. And the sodium chloride, 0.9%. I'm going to check the bags for any discoloration, check the clarity and the expiration date. No holes, and they look ready to go. Okay, so we'll scan the badge. Check it again, Shanae O'Connor. It's the right time, right dose, right patient. Before I hang this, let me get the patency of the IV. I don't see any swelling, any redness.
Okay, then checking it for expiration date.
Does it burn?
Making sure it matches the
No,
order.
it's okay.
Okay.
And there's no leaking, holes, the color seems
Okay,
fine.
flush is fine. I'm just gonna leave that
Okay,
hooked
I'm
up.
getting this for 30 milliliters per hour.
gross motor accessible for short people. Mm-mm.
So we're giving your medication alongside this.
Oh, can I lower it?
Do you need help?
This is. No, I'm okay.
I'm gonna spike the tube. Just gonna spike the tube. Make sure both the spike and the bag port are sterile. Make sure. And it is clear. So we are first going to prime the bag. Make sure there's no air bubbles.
Alrighty, so I'm going to prime the tubing. Hmm.
Or the antibiotic.
There we go. Okay, assessing for air bubbles, looks good to go. I'll go ahead and hook it up to my IV. Okay, so channel select.
Mm-hmm.
Getting this ready.
Guardrail IV fluid. This is the 0.9% normal saline.
It'll all at once. So
We
I'm gonna
are
just prepare the line
increasing
first,
at 30
and then I'll
milliliters
start
per hour. And I'm setting at 950 so it doesn't run dry.
oh wait, let me check
And
this.
starting.
Let me check for clarity. I'll make sure it's the right medication and NM Celastatin. It's not expired and the color is fine. I won't administer it though, but just make sure. Set up. In the bag. So that both those are sterile.
Okay, so now we will hook up the imipenem. So again, we'll scan the patient's armband, scan the medication. is primed.
Search for. And you do have a right to receive. I'd like to have. So, your patient identifying.
Okay, so I'm gonna set up my secondary. Right, go to imipenem, celastatin, which
Is
is
1,000, but we're gonna put in 950, so it doesn't run
100 milligrams. Set it for 1 hour.
We have 500.
And start.
500 to 100.
Go ahead and tag the lines with my initials, date and time.
Duration for this one is. Okay. Leave the clamps closed. Haven't started it
Sign
yet.
the MAR that they're given. Okay, bed is down, collate is in reach. Do you have any questions for me?
No, I think you answered them all. Thank you.
Okay, wonderful. If you have any signs or symptoms that we discussed, put on your collate.
Okay, I will.
How do you know the fluid's running?
I'm checking for 5 drops,
Okay.
which they're coming out just fine.
Yeah, I was watching them.
Awesome. Okay.
I have a few questions.
Okay, give it to me.
Were there any pertinent pieces of information you reviewed before administering the client the medication?
Yes, I double-checked allergies, double-checked drug compatibility, and the 5 rights of drug administration. So, the right patient, the right drug, dose, time, and route.
Did this information affect your decision to administer the medication?
Yes, it allowed me to administer the medication appropriately and accurately by confirming that information.
Did this information affect how you administered the medication?
Just the confirmation of the Y-site compatibility and the patent IV allowed me to hang the bags and administer the infusion.
Okay.